Hi, I'm Dr. Vonda Wright, and this is Hot for Your Health. Join us for conversations on the bleeding edge of science, health, and culture as we bring you tech innovators, thought leaders, and the movers and shakers who are transforming science fiction into your new health reality. Hi, everybody. It's Dr. Vonda Wright, and welcome back to another episode of Hot for Your Health. And more than usual, today's episode is really all about what's hot in health. Dr. Marty Makary, who is not only a distinguished practicing surgeon, I like to say it that way to let everybody know that, like me, he still cares for patients all the time. He is a professor of surgery at Johns Hopkins and is recognized across the globe for his health policy and patient safety interests. Now, today we're going to be focusing on his latest book, which if you're watching on YouTube is Blind Spots. But he is a prolific writer and has written many other books and continues, especially now, I've seen you all over the place, Marty, contributing to national discussions on healthcare reform. So I'm so pleased to have you today and take the time away from all of your busy schedules to really talk to us about your point of view in medicine from a practicing surgeon perspective, a health researcher, and a health communicator. So thank you.
Oh, good to be with you, Vonda. Thanks for having me. It is an interesting culture that we are a part of in medicine. So enjoy these conversations.
You know, one of the things that is the very nature of science is to question science. And I think there's the misperception that dogma is dogma. If it's a rule, we never question it. And sometimes that's how things progress. Like, don't question this. Somebody important said it. But that's not your perspective at all, is it?
No, look, the purpose of science, I agree, is to challenge deeply held assumptions. And we have a lot of them. There are a lot of assumptions in medicine. We have an epidemic of medical dogma. And we're reeling in right now from a very damning study that just got published in JAMA Network. And that was trust in doctors and hospitals is way down from 71% before the pandemic to 40% today. That's a 31-point drop.
Wow.
So, yeah, some doctors have told me, almost every doctor who's read the book has loved it, but some have been very defensive and said, you know, because you're pointing out things that we have gotten wrong, people could then question doctors and hospitals and not trust us. And you know, how dare you challenge a lot of our mistakes? But that's why there's mistrust, because we don't reckon what we've gotten wrong. We don't correct the record. We don't show humility. And it's often a small group of doctors at the top who are kind of making edicts for every other doctor in the country.
And you know what? That just shouts, and listen, I'm a surgeon, so I say this honestly, shouts ego.
Yes.
We are, you know, I can't believe she said it to me, but my 17-year-old daughter once said to me, Mom, your ego will not let you be wrong. And then when I stepped back from that, I realized, oh my God, she's right. And it changed my whole world. Is that what we're going through with doctors? It's not that the data can't be questioned. Our own egos can't be wrong.
Yeah, pride, I think, is a big part of it because, well, look at our track record in modern medicine. We're not doing a history lesson here. This is in modern medicine. We've gotten the food pyramid wrong for 70 years. We got natural saturated fat wrong for 60 years. We still get it wrong. We got peanut allergy guidance wrong for 15 years. We got opioids are non-addictive wrong for 22 years. We got hormone replacement therapy. We still get it wrong, unfairly demonizing it for 22 years. So, I mean, it's not like we're in an enlightened era now where we recognize all these dogmas that are out there. It's on the contrary. We have more censorship and more, I wouldn't say it's that diabolical. It's more a sort of country club concept of a small group of doctors get together and they decide at the NIH what everyone should be studying, what the research should be done on. Pharma has a hammerlock on the research enterprise. And so everyone's kind of doing what they perceive to be good. But why are we funding these crazy experiments at the NIH that have no relevance to human health and not study school lunch programs and how we can treat diabetes with cooking classes and other interventions instead of just throwing meds at people? We're not talking about the root causes of our chronic disease epidemic that is exploding in our lifetime. And I think that's the biggest blind spot today.
Have you seen in the national zeitgeist a pivot amongst the people themselves, however? I mean, maybe this decrease in faith in doctors reflects the fact that I believe my patients are smart people.
Yeah, I think we are seeing a revolution right now. There's an expanding tribe of doctors who are getting off the hamster wheel, yourself included, and we're saying we're going to go directly to the public and educate them about the truth on so many things about health that they don't know about, that they need to know about. We're seeing medical students now saying, I don't want to have anything to do with this seeing 40 patients in a day stuff. I don't want to do that. I want to be an entrepreneur and advance health by creating new systems. I want to talk about food as medicine. How much time did we spend in med school learning about seed oils and ultra processed foods and food dyes and DHC and pesticides and atrazine? Zero, absolutely zero. And they know it.
About you.
I mean, I think people, even in the medical field, know that we have gotten an inadequate education. We're practicing with a hammer instead of dealing with the root causes. We're playing whack-a-mole. It's not working. The health of the population is getting worse. I mean, every single metric of the health of the population is getting worse. Yes, we're good at sophisticated operations. You and I have seen that, witnessed it, been a part of it. Yes, we're good at emergencies. But when it comes to the health of the population, look at the numbers. Early onset Alzheimer's has gone up threefold in the last decade. Diabetes, prediabetes, now 2/3 of the population. Obesity, overweight, now half of our nation's children. In Japan, it's 3%. Infertility is going up. PCOS, the sperm counts are down 50% in the last 5 years. The age of puberty goes down every year by a week and a half. It's now years sooner than it was a generation ago. No one is talking about these giant issues. They're in our blind spots. They're extremely relevant. I mean, heck, this may be an existential threat to our species. And no one is willing to talk about root causes. And I don't think it's because we're bad people. I think we're so busy in medicine, billing and coding and seeing patients in short visits. We're measured by our throughput.
I know. I know we are driven by the 15-minute insurance reimbursed, which when I tell business people how little physicians with 22 years of formal education are actually reimbursed, but the fact of the matter is that drives clinics, and you and I have kind of jumped off that, frankly, and it's very freeing. But the question is, then I have so many questions, but based on what you just said, how do we democratize to everybody? Because many of us now have concierge practices out of necessity, but how do we democratize it to every person that has the 2/3 of people who now have diabetes or the 50% that are obese? How does democratization happen?
I think it happens, my opinion, it happens gradually. We educate the public. People have no idea that there are 38 different pesticides detected in an average school lunch program in the Washington, D.C. area where I live. They have no idea. Now, if we can educate people that these pesticides kill insects, So what do you think they do to our microbiome, the bacterial lining of our gut that's central to mood and digestion and immunity and so many other things? So we've got to educate people. We're also seeing some innovative strategies now. Employer-sponsored healthcare are making that sort of non-treadmill kind of medical care available to their employees. So doctors can spend time with patients and talk about their sleep quality and the other underlying root causes. We have to educate physicians. I mean, how many doctors refuse to prescribe hormone replacement therapy because they still believe that it causes breast cancer, that it increases the risk, right? So we've got to educate physicians, and they know their education has been lacking and inadequate.
Yeah.
So I think it's gradual.
Yeah. Well, I love that you are not only out educating doctors, and I've seen you, I think, recently testifying in a special congressional session, but the general public. And, something that as I started reading your book, we're going to talk about some of the amazing stories and blind spots here. Your publisher said, I'm so thankful, and I've marked it all up. Holy cow, who knew about the peanut allergy? Other than I can't have a bag of peanuts on an airplane anymore. And maybe that's okay. But for those viewers who have not yet picked up this book, let's just start with chapter 1, which is, how in the world are we the only country so allergic to peanuts? And I want to tell you, I felt very supported by this chapter, as I grew up on a farm and ate dirt. And I was a mother who never put the special wrappy things on the grocery carts. I don't know. My kids probably put their mouths all over those germs. But go ahead. Let's talk about peanut allergies in this country.
Yeah, I mean, we need to ask big question. And one of those biggest questions is, why do we have an epidemic of peanut allergies and it doesn't exist in other countries? You don't have any peanut allergies in Africa. We've got African health professionals that come to Johns Hopkins, and they're blown away by the peanut allergies in the United States, by the peanut label on every package, on announcements, on airplanes, on waiters asking. They're like, what's going on here? What is it about peanut allergies in the United States? Well, it's not genetic, as we've been suggested.
Yeah.
What happened was, in the year 2000, the American Academy of Pediatrics decided to tell mothers to avoid all peanut butter and peanut products for young children until they turn 3 years of age. That peanut abstinence in the first 3 years of life sensitizes the immune system and increases the risk of peanut allergies later in childhood. And so they forgot about a basic principle called immune tolerance, or early exposure can be sort of a natural immunization. Or people had known it as the dirt theory, as you alluded to. I mean, this was well known in immunology, but a small group of doctors at the American Academy of Pediatrics ignored this body of evidence, went ahead and issued this decree, got pediatricians nationwide to get on the bandwagon and chant the mantra, recite the catechism, avoid all peanut butter and peanuts for young children until they turn 3.
Yeah.
Well, it ignited the modern day peanut allergy epidemic. And as peanut allergies started to increase in the years after that recommendation, they thought, we have to double down. We must have non-compliant moms out there who are anti-science. We have to get better enforcement. And so they doubled down. It just kept making the problem worse. It was this self-licking ice cream cone, because when kids had to get rid of peanuts and peanut butter in the home because an older kid was allergic, younger kids were not exposed to it, and they got more sensitized, and schools began to ban it. And we're reeling in from a giant disaster that was ignited by the medical establishment's hubris.
Well, and those listening, I don't want to make light of the fact, as you do in your book. I mean, it's frightening if your child has developed this. My best friend, I went to the University of Chicago for medical school, and her eldest child somehow developed this, and in a public place had a life-changing reaction. So we're not making light of it, but we are pointing to the fact of what you said is a small body of decision makers has changed the trajectory of health for a generation around something as simple as a peanut.
That's right. And as the problem got worse and worse for 15 years into this recommendation, I mean, it was just proven wrong 9 years ago. And by the way, you didn't hear an apology or a big reckoning. They kind of faded out and wrote a little statement.
Yeah.
And people are still confused about this. I mean, you actually should be introducing peanut butter when a kid is 5 or 6 months of age, just a little bit. And a bunch of other things too. I mean, that's the best practices. People are not even aware of it. But as peanut allergies surged over those 15 years of the medical dogma being chanted, we saw a new kind of allergy more commonly in the emergency department, which is the ultra severe anaphylactic reaction. That is, a kid could have trouble breathing just being near a peanut. That's how sensitive the allergies were. And you're right, those are real. We shouldn't mock it. This is the result of medical dogma.
Well, you know what? People always other mothers raise their eyebrows at me when I say, out of convenience, when I had my last child, we have 6 children, but my only biological child. I know we were busy. It's a busy family, but the child I bore myself, I was a busy surgeon at the time, and I did not have time for all the prep. This poor child had to eat mashed up food off my plate. But you know what I think that did? It not only exposed her to all the things that had kept me healthy, because you can envision that I try to keep pretty healthy, but probably built her immune system because of the exposure outside of prepackaged baby substances. And so I'm not suggesting, because I'm pretty sure pediatricians are shaking their heads when I say it, but come on, that's the way babies have been raised for millennia, eating smashed up what their adults do. So this is a fascinating example of this small body of doctors phenomenon. But as you can imagine, many of my listeners are 30 to 65-year-old women, because I am big into the midlife conversation, and as the only orthopedic surgeons talking about the musculoskeletal part of it, they're going to want to know your take on the WHI. And let me tell you, every Monday, Tuesday, and Thursday when I am in clinic and I have a midlife woman who comes in whose shoulder does not move, I'm demonstrating for people who can see the video, I am amazed at how many women I start to introduce perimenopause and menopause to, and without prompting, they're like, oh yeah, my Aunt Minnie had cancer. I am so never going there. The misinformation that the WHI was, the travesty, and I'll assign it that word, of the WHI study is generational. I mean, it's going to take a long time. So I really loved that chapter in your book because, frankly, it's all the data in one place and a fascinating story. Do you want to summarize for those listening?
Yeah, I agree with you. It's one of the greatest tragedies, I think the biggest screw up of modern medicine that is ongoing, that has still not yet been corrected. 22 years ago, a doctor did a terrible thing. A doctor from the NIH with big time credentials, announced at a press conference that he had just completed a study, and the study found that hormone replacement therapy in perimenopausal women, something millions of women had benefited from, causes breast cancer. He did not release his data. 2 weeks later, when the data came out, it turns out there was no statistically significant increase in breast cancer. I interviewed him for the book Blind Spots, and he acknowledged to me that there was no increase in breast cancer mortality in a study, but he just believed in his gut that it did increase the risk of breast cancer. It's unbelievable. The disservice he did, he misrepresented his data, and to this day, 80% of doctors still believe that finding. What's amazing is when I did the investigation, a couple of his co-authors were convened before the announcement, and they were basically hoodwinked. They were told, hey, they were doing the largest study ever done in the history of medicine, $1 billion taxpayer funded study with 40 different investigators who were the leads at the different sites around the country. He gathered them in a hotel in Chicago called the Sofitel. And he told them, hey, you can throw out the agenda. We've got a new announcement. It turns out that we found it causes breast cancer. We're closing the study and we're making the announcement. And they're just blown away because they were not told about this. And then when they were given the data at the meeting, they were like, wait a minute, you can't say this causes breast cancer. And they get into a shouting match. And one of the guys, who's an American hero, in my opinion, fought and fought and fought. And he yelled in that meeting, if you dangle something as scary as breast cancer, if you put that fear out there in front of women, when it's not supported by the data, you will never be able to undo it. You will never, quote, be able to put the genie back in the bottle. And he was right. That fear still looms today, and it still results in at least 50 million women over the last 22 years have been denied or never offered, never discussed hormone therapy, despite its benefits, not only short-term in alleviating the symptoms of menopause, hot flashes, night sweats, mood swings, weight gain, 50 plus different manifestations that can happen with the symptoms of menopause, but long-term, there are incredible benefits. And we're talking about lowering the risk of fatal heart attacks by 50%. We're talking a 35% reduction in the risk of Alzheimer's, a 50 to 60% reduction in cognitive decline. And of course, as you know better than anyone, your bones are stronger because it prevents osteoporosis.
You know, my mother is 84 years old, and she was one of these women. She was on hormone replacement when it was allowed. She was taken off because of WHI. And then as soon as, honestly, in her 60s, she started living close to me again. I sent her to a hormone doctor and they put her back on. And at 84, she has normal bone density. And so as the world, within the menopause societies are debating what you just said, I have no doubt of the data holds what you just said, but there's internal debate about the brain and the heart. I boldly stand on a mountain and say, okay, you guys squabble amongst yourselves, but I will take the 50% of women's lives that I can save with your bone health, because, you know, women, 1 in 2 women are going to have a fracture, and in a large percentage die from those. I mean, I'm a practicing surgeon. You know what it's like to appear at the bedside of a crumpled up woman in pain. And so I love the way you summarize it. It's just so clear when you look at the data, in which you outline in a table form. I mean, the statistics don't match up. And I'm going to tell you for sure, I don't know if baby booming women tell you this, but my 60-year-old baby booming women are so angry because, you know, they're outside the easy 10-year window. I believe every woman should be allowed to have a risk assessment of her own, no matter what her age is, and that there are very few reasons not to rebuild a woman with hormone replacement. But that being said, baby booming women are the primary generation that have been left out.
Yeah.
It's my generation. I'm 57. My generation, we're going to fix this. And my millennial children, it's going to be smooth sailing if I have anything to do with it. So when you read these data or you uncover these stories, I mean, there's so many stories in the book. Are you fascinated? Are you left with a heavy heart? Are you like, holy F, what is going on? What is your response?
All of the above. I mean, I was not, I write books. I've written 2 other New York Times bestsellers. I was not planning to write this book, but as I'm intellectually curious, and as I would talk to doctors and learn about these giant scandals, how medical dogma is still misleading doctors and the public alike. Women have a right to be angry at this hormone replacement therapy boondoggle of demonizing it. They have a right to be angry. I'm angry. My mom went through perimenopause right around the time of the announcement. So, of course, her doctors did not offer it. She just Well, first of all, I love my mom. Women who take hormone replacement therapy starting around the time of perimenopause live about 3.5 years longer. I want my mom to be around. She broke a bone. She fell. She had a fracture of her hand. It was borderline whether or not it needed surgery. I ran it by a bunch of good surgeons like yourself, and the vote was to do the surgery. So I trust those doctors who recommended it. She had surgery, but if she would have been on hormone replacement therapy, I can only imagine her bones would have been stronger. If it was that borderline, if she needed surgery, she wouldn't have needed surgery. And guess what happens? You know better than anyone. Surgery results in immobility, which in older people can be a cascade of events. I mean, people don't appreciate the fact that the 1 year mortality from a hip replacement is like, what, 22%?
Hi.
Right. So, I mean, people have a right to be angry. And I felt when I was learning about all of these issues, and people have this blind trust in whatever comes out of our associations.
Mm.
I trust rank and file doctors far more than I trust these old dinosaurs at the associations who are proud in issuing these edicts from on high. I felt like people need to know the truth. People do not know the truth. Even doctors, I would share research on gut health and the microbiome. Amazing new research, like that Mayo Clinic study I mentioned in the book, to my colleagues at Hopkins. And they were like, gosh, I had no idea. This is amazing. Now, if they had no idea, and they're the experts at Johns Hopkins, how much of an opportunity is there to educate the public and medical community alike with a book? And that's why I said, I've got to write this book.
Well, I'm sure glad you did because people don't all researchers don't realize it, but here's my ego again. I just published a paper that's been downloaded about 250,000 times because the need is so great. It's in a musculoskeletal syndrome of menopause. So I was looking up how many times on average is a great research paper downloaded or read. And do you know what? British Medical Journal, JAMA, and New England Journal, on average, their best scientists writing the best articles, only 10,000 people read them. And they estimate that half of the research published in our journals is only read by the team that authored it. So it is not surprising. It is not surprising that nobody knows the good stuff. So that's why I think books like Blind Spot and people like you that will take the time and hard work to dive through all the nitty-gritty data are so critical. But I got to tell you for sure, and tell me if this has ever happened to you, academics are sometimes criticized for being too accessible. Like, I have been criticized hugely for talking to the public. I'm like, who else am I going to talk to? They're my patients.
Yeah.
So
We've got to do it. Keep doing it. We've got to do it.
quality, right?
Yes. I I don't mean to laugh, but that is the best thing I've heard all week. Only half the research studies are read, but I'm deep in research. That's really 90% now of what I do is public health research. And I've published, gosh, I've done everything you're supposed to do in academics. Get tenure, published, National Academy, whatever, all the societies and regalia and badges and robes and all the dumb stuff, right? And I've published 300 plus scientific articles in the peer review literature. And it hit me at a certain point. Nobody's reading them. Like this, we don't, right? We live in a society where this culture in medicine where they issue edicts from on high, and then it's kind of locker room banter. And it's like, it's not. And so tragically to this day, doctors are really not even taught about menopause because it's thought, well, there's nothing you can do for it because the one thing that sort of cures it causes cancer. So why do we even need to teach it? And this was a male-dominated culture in medicine for a long time. And so today a woman will come in with perimenopausal symptoms and is more likely to be prescribed an antidepressant than they are estrogen.
Yeah. 25% increase in antidepressant prescription after 2002.
And no end in sight.
Oh, and no end in sight. No. And women say to me unprompted, I think I'm going crazy. No one will listen to me. So let's pivot because I want our conversation to be as what I'm sure you intended educational and hopeful. So how do we pivot now? Because you've so soundly made a case for the fact that we need to question science, which is what science is about, and we need to be informed consumers. You can't just be a passive recipient of whatever somebody advice is giving you. We have to be thinking people. But how can we pivot this conversation to hope? What do you want your patients to come to you with from a question standpoint, from a conversation standpoint?
I think it's helpful for people to think of healthcare in terms of the hospital doctor world is really a sickness system.
Mhm.
And while a few of us, including yourself, have defected to actually talk about health, not just stomping out disease in late stages,
Fair.
um, people need to recognize it's a sickness system and we don't have health literacy, and people need to know the basics of health literacy. And that starts with food. Now, of course, I try to cover all the big topics in health in the book. It's not comprehensive, but there's a bunch of us now. There's Casey Means, Peter Attia, a bunch of folks, and it's really an incredible complementary education to what's not taught in medical school that needs to be taught, and everybody needs to know about it. So if you are in an emergency, do whatever the doctor says. But when it comes to chronic issues, prevention is really about our lifestyle and what we eat. It's not what the medical establishment has brainwashed us to believe. Prevention is not just doing mammograms earlier and earlier and earlier. It's not just about medical interventions. It is really about food. And people need to know that 60 to 70% of the food supply today is ultra processed foods. You want to get back to whole foods. You want to eat organic, especially when you're eating the surface of a fruit or vegetable where the number of pesticides coating them are significant. A strawberry has been sprayed over a dozen times with 8 different pesticides on average. You really should be eating organic, especially when we're talking about kids. One of those weed killers called atrazine is in the famous atrazine frog study that was suppressed for a long time. It converted female frogs to male frogs at the tadpole stage with exposure. I mean, this is a hormone disruptor. And guess what? The age of puberty is going down. Infertility is increasing. So it's important. People think, oh, I don't want to spend, the extra money for organic fruits or vegetables. When you're eating the surface and they're coated with those chemicals, that's something that everybody can do. Avoid seed oils like vegetable oil, soybean, corn oil. They sound healthy, but they're not. They're denatured at high temperatures and they are changed with a chemical solvent. And so when they hit your body, they increase inflammation. And guess what's at the basis of so many of our diseases, including cancers and autoimmune diseases that now affect 1 in 5 women? It's inflammation and insulin resistance. And these basic principles, they're at the root of so many of the issues around disease prevention and health. So those are some general take-home messages. There's a bunch more, but I think at the risk of getting too deep, I think it's good to think of a couple things that people can do to live healthier. But this is what we need to do: educate educate the public, change the culture in medicine, and work. One of my big projects is working on a policy level to change where we fund research. Do we really need to be funding research on bat coronaviruses in caves in China? Or can we study school lunch programs instead of just putting every overweight kid on Ozempic? Can we treat more diabetes with cooking classes? Can we treat more back pain with ice and physical therapy instead of just surgery and opioids? And can we talk about environmental exposures that cause cancer, not just the chemo to treat it? We've got to address food as medicine and general body inflammation. We're not doing that, but I do think there's a revolution to put these issues at the forefront right now.
Well, and I think the message is rising. I mean, and sometimes I think maybe I've heard it a lot because I'm in a bubble of this information, but I think even in the general public, people have an idea, at least my patients do. They may not know the nitty-gritty, but they have an idea. So do you think of all the things that we tell people they need, the information overload? Is nutrition at the center of it? If we start with one thing, we go buy organic northern white beans because they're cheap. Is that the first step for people listening?
I do think food is number one. Now, exercise is a close second, but you'll see the food industry exert their sort of corporate political influence to try to change the national conversation to say it's all about exercise. The reason why half of our nation's children today, they will say, is because they're not active, they're lazy. Well, it's actually both. And food is the much bigger part. We have poisoned our food supply with highly engineered chemicals to make food addictive. It's ultra processed food. We've added poisons and toxins. These pesticides are showing up in the urine of children and the cord blood of newborn babies. We have got to recognize we've got corporate capture that has not allowed us to talk about these issues. We've got an NIH that has lost its way, and we've got pharma that controls the research enterprise. But so the issues we are focused on in modern medicine are not the issues central to health. So we've got to talk about food. And I do think it's a big issue. And when you look at our medical school education, Vonda, we didn't spend any time on nutrition, and the little few minutes or hours that are spent on nutrition today is mostly misinformation. It comes from the old food pyramid, demonizing cholesterol. You know, the great irony of cholesterol, we've got the medical establishment has convinced the entire American population to tiptoe around cholesterol, avoid cholesterol. Here's Cheerios that can help lower your cholesterol, even though it's got chemicals and ultra processed food. The American Heart Association sells a low cholesterol cookbook. The great irony is that the cholesterol we eat is not even absorbed. It doesn't contribute.
Yes, I read that in your book. I read
It's amazing. The irony. It's amazing.
It is amazing. I had a crazy idea because but I need some good partners to do it. We are so captive to the NIH funding, right? To your point, the only zebrafish studies or whatever by, some niche group of interested worm scientists or whatever they are. Listen, thank God they've been working hard their whole lives. What if those of us like you and me that are loud enough and have platforms, what if we crowdsource this, crowdfund this? What if we could get your 10 million people and my 10 million people to say my health is worth $10? I really feel like a groundswell and not being victims of time and policy. I just think that those of us need to think about that together. You guys can all come to Florida and we'll put our heads together. Because I really think that if we want people to change, we got to involve people in it instead of just shouting at them, involve them in the change. So that's just my crazy idea. But before my mind escapes, you can see how my mind works. I have a lot of ideas. I asked my very favorite medical student the other day, he's a 4, he's about to try to get an ortho residency. I said, give me your curriculum give me your pathophysiology curriculum for the first 2 years. They do the kind of med school where for 6 weeks, they're just like heart, 6 weeks gut. And so I asked him for the curriculum, and this 60-page document and I'm reading through, and it's every disease imaginable. And I said, well, where do they tell you the lifestyle choices or how to prevent that? I asked him, where is the prevention in this? This is all the pathophysiology, not unlike my own med school. Where's the prevention? And he said, well, they throw it in the end and they mention doing lifestyle choices. Because I didn't see it on the curriculum. I didn't see lifestyle A, B, C. And I said, well, what do you mean that they just say lifestyle choices? And I kid you not, Marty, we prevent these with lifestyle choices. So if in The modern curriculum, it's a casual mention to lifestyle choices. I thought in 2025, I'm doing a series of podcasts on the new curriculum. We'll take the pathophysiology curriculum and have people like you come along and tell me, okay, here's the disease. What are the specific lifestyle prevention? Because otherwise, our students are not going to know. Look at me, I'm going on like a soliloquy. Nobody's going to know because saying prevention is not enough, right?
Yep. Yeah, and what we need to fix is a small private company controls every medical school, controls the curricula and writes the exams that they take. And so if these old guard people in the medical establishment don't understand the microbiome, there's no questions on the microbiome, even though it's central to health. There's no section in the curriculum for food, or we don't even talk about obesity. Heck, you saw during COVID, the number one preventable common risk factor for COVID mortality was obesity and the metabolic syndrome. Never once did anyone talk about obesity. What did we do? We locked people up for nearly 2 years. They gained 15 pounds and they ate ultra-processed foods, inducing a worsening metabolic syndrome. No one dares talk about these things. So I like what you're saying. I think it is the future. And I think there's an awareness now among the students that, hey, we're not being told the full story here.
Yeah. I have great hope for the future medical students for many reasons. I agree with you. They are aware. They're also not willing to sacrifice their own youth like you and I did, living in a hospital 136 hours a week. I mean, that is no way to treat any person. But you know what? Young doctors are treated that way. So I have great hope for them because they're not willing to live like that. And that will translate to their patients, don't you think?
Yes, absolutely. We need to model. I want to say teach, but it's not a classroom thing. You have to model this. We have to model humility. What makes a good doctor, I tell my residents at Johns Hopkins, is knowing your limits. It's saying, I don't know when that's the right answer. It's being honest with patients. It's evolving your position rapidly as you get new information, not digging in to some position like a politician would. We've got to teach not just the technical skills of stitching patients and learning indications of drugs. We've got to teach the non-technical skills of being a doctor, listening to a patient, trying to understand what they believe is causing their problems. Does the problem run in their family? Is it something that can be avoided by addressing their situation? You have to spend time with people to do this. And I don't think we model that. I think we model, hey, wow, this guy saw 50 patients in one clinic. Isn't that amazing? No, that's a tragedy, right? That's right. So communication skills, building a team, humility, these are the non-technical skills we don't teach. We only teach the technical skills. And it turns out the non-technical skills are more important.
I agree with you, especially as now data is abundant and it's really the assimilators that will rise. Well, you know what? Obviously, we could go on for hours, but as I commented, I want people to finish this information on their Zone 2 training, their 45 minutes. So I encourage all of you to either download on Audible or buy this hardcover book. If you need to be like me, highlighting and writing in the margins, Blind Spots, When Medicine Gets It Wrong and what it means for its health, by Dr. Marty Makary, which is now in its 5th week on the New York Times bestseller list. So thank you so much for your time and for being here. I can't wait to learn more from you.
Oh, thank you so much, Vonda. Really enjoyed our conversation and keep up the good work.
Thanks so much. I'm Dr. Vonda Wright. See you next week.